Hi, welcome everyone. Today we have webinar on HIC NABH 5th edition. Before starting webinar, I would like to give the introduction about my company. We are Astron Group. We are 18 years old company. We are doing NABH JCI for the hospital. Also, we are in hospital planning, designing. And we have 50 plus more certified courses for nurses and technician programs. Now I would like to introduce Miss Megha ma'am. She is clinically microbiologist, primary super specialty hospital, Chanakpuri. She has worked as clinical microbiologist in various healthcare organizations, having more than 10 years of experience. She is actively associated with infection control team of Primus Super Specialty Hospital. She has completed PGD HHA and PGDQM, also certified internal auditor in ISO 15189 NABL and NABH standards. She is a member of International Nosocomial Infection Control Consortium INICC. It's over to you, ma'am. You can start the webinar.
Thank you. Good afternoon, everyone. Today we will discuss about the infection control activities for reducing the hospital acquired infection. You can note down each and every point. I hope you are working in a NABH hospital for the hospital infection control department. So these activities, these points will help you for reducing the infection control rate in your organization. So we will discuss the fifth chapter in the fifth edition of NABH. HIC is hospital infection control department. This is a particular separate chapter in the NABH fifth edition standards. We will discuss what is the NABH, what is the importance of NABH, then hospital infection control, standards of HIC, objective elements, and the required documents for implementation. Now, first we will start from the importance of NABH. Why it is necessary? NABH is not necessary basically. It is required for seeing the facility which we are providing to the patient. It is adequate or not. If your organization is providing the appropriate practices for the patient care, healthcare, and for the healthcare providers, you can go for the NABH accreditation. If your hospital is NABH accredited, the NABH will give you the 5 rating. So according to the rating, your hospital will improve yourself. Secondly, is NABH mandatory for hospital? So it is not mandatory. If you want to improve your quality, if you know that your organization can improve quality, can give better services to your patients and healthcare providers, then you can go for the NABH. Third is, what is HIC in NABH? HIC in NABH is just a hospital infection reducing factor. From this element, from this standard, you can reduce the nosocomial infection to the patients which you are providing to the patients in your organization. Now, last is, what is HIC in hospital? In hospital, HIC is infection reducing element. Again, for reducing the transmission of nosocomial infection in IPD patients and OPD patients also. What are the hospital infection control elements? So it is hospital infection control program will help in reducing the nosocomial infection that I already told you. It is not only in the patients, it is which infection is transmitted to the patient, one patient to another patient, patient to staff, and staff to patient also. So it is a break point which you need to work on the mode of transmission of infection from one person to another person. Second, It will provide proper facility and adequate resources for the hospital infection reducing factor. uh, as per
यहाँ ना गया है क्या पेशेंट?
as per infection control, hospital infection control policies and procedures, the organization will provide you the adequate facilities and resources for reducing the infection.
और एक आया है ना.
Could you please mute yourself? Third is, in this chapter, we will discuss the antimicrobial management program, how we need to use the antibiotics, the use of restricted antibiotics, and the stewardship program will cover in this chapter. Surveillance activities, which type of surveillance activities you need to do for reducing the infection in your organization, which type of disinfectant, and what is the biomedical waste management for healthcare organization. So these are the basic points which we are covering in the hospital infection control department. So there are total 8 standards in this chapter. Hospital infection control. This is one chapter in NABH booklet, and there are 8 standards in this chapter. In these 8 standards, we are covering 51 elements. So these are the
आपकी क्लास के बच्चे ना मैम
these are
तो
the
मैंने
8
कहा ये वापस
standards.
करने फाइल
HIC1, HIC2, HIC3, HIC4, 5, 6, 7, and 8. These are the main points. These are the standards for NABH 5th edition. So for these points, we need to work for the documentation, for the practical aspects, and for the clinical aspects also. So in standards, first standard is the organization has the comprehensive and coordinated hospital infection control programs that aims for reducing the infection to patients, visitors, providers of healthcare, and multi-specialty. So for this element, you need to prepare a manual. This is the first element. You need to prepare the manual, and you need to prepare your complete documentation regarding the manual and policies in HIC1. There are so many elements. Few are core elements, few are complementary elements, achievement elements, and excellences. So these are the 4 categories. First, I already told you that is the first element in which we are covering the manual. So these are the points, these are the elements which you are covering in your manual as the policies and as per the outsource policies like CDC guidelines and WHO guidelines. So these you can take the references from these 2 guidelines. One is from CDC and one is from WHO. First point is the hospital infection prevention and control program is documented, which aims at preventing and reducing the risk of healthcare associated infection in hospital. This is the core element. Core element means you have to do this. You have to make your policies as per your hospital structure, as per your scope. So this should be documented in your manual. Second is the hospital infection prevention and control program identify high risk activities and has written guidelines to identify these high risk activities, these high risk procedures in your manual. These high risk activities include hand hygiene, spill management, how you handle your spill management, how you handle the major and minor and sharp management also, how will you how you manage your waste, biomedical waste also. So these points will come in your manual. So in first point in your manual, you need to identify the high risk activities like hand hygiene, spill management, and the exposure of contaminated waste items. So you have to write these activities in your manual. Third point is C. The infection prevention and control program is reviewed and updated at least once in a year. This is the commitment. You need to commit that you are improving your program day by day. You are improving your program day by day active with day by day activities, and implement is and so if you are doing any type of change in your manual in 1 year, then you have to discuss these changes in your meeting, in your HIC committee meetings, and you need to implement these changes in your manual in annually, once in a year. D is the infection prevention and control program is reviewed based on the infection control assessment tool. So this is the new element. If you feel like your organization is sufficient to fill this assessment tool, you can you can download this assessment tool from the WHO site. This is the particular one tool with 9 or I think 15 pages. These uh, these tool uh, covered all the elements, covered all the aspect related HIC, and you have to fill this tool. So if you fill this and mark yourself, that it will give you a better achievement. E is the organization has multidisciplinary infection control committee, which coordinates all the infection prevention and control activities. This is also commitment. Your organization identify a particular committee members. This committee covers one from the management, one from the administrator, one from the OT department, like OT in charge or OT clinicians, microbiologist, infection control officer, infection control nurse, NS, quality manager, and the supportive departments also, like pharmacy, kitchen, laundry, CSSD. If you find out some non-compliance from these departments, you can call them also. So it will create a complete committee. So and you have to write down these committee members' name and designations in your manual also. Last one is F. F is the organization has the infection control team, which coordinates the implementation of all the infection prevention and control activities. Committee is one. In committee, we will discuss only once in a month, or when the meeting required, when we find any non-compliant, major non-compliant, when we find any outbreak, we can call the committee members for some type of discussions. But the infection control team is different. It works on the daily basis for day-to-day activities, and these are the active members in the hospital infection control department. And this team is complete with microbiologist, infection control officer, and the infection control nurse. G is the organization has designed infection control officer as per the infection control as a part of infection control team. This is also a commitment. The organization designed the infection control officer. This infection control officer should be a microbiologist, or if your organization is the small organization, any clinician or physician is also a part of this team and designate as the infection control officer. This designation and the job description also written in the manual. H is the organization has designed infection control nurse as part the infection control team. This is also a commitment. For this, the organization has a certified infection control nurse for the day-to-day activities. So if your organization is big, like more than 250 bedded, your infection control nurse is linked with another nurse also. I is the organization implement information, education, and communications program for infection prevention and control activities to the for the community. For this, you can teach, you can give education program to your patients also, to staff, and for the attendants also, so that we can reduce the infections from the committee. This is also documented in your manual. J is the organization participates for measuring the community outbreaks. If you find out any outbreak, any outbreak from outside the or outside your organization, in that case also your organization can participate for that particular outbreaks. Now, second, so first HIC1 is completely about the documentation, the points which we covered that will be written in your manual. Second is the organizations provide adequate and appropriate resources for infection prevention and control. Now, first element is the management make available resources required for the infection control program. This is the core element. In this core element, the management heads decided a proper budget, decided the proper program which will be used for reducing the infection. So the management will provide you the man resources and the inventory of materialistic resources also. It will be make sure by the management, because they will provide you a particular budget for that particular uses of reducing the infection. Second is the organization earmark adequate fund from its annual budget in this regards. This is also a commitment as per the guidelines, as per the CDC and WHO guideline. 2% of the annual income of hospital will be separated for the NABH HIC activities, and it will make a proper Excel sheet so that we can identify where we are using this budget, and this sheet will be controlled by the HIC department, controlled by the finance department also. C is adequate and appropriate PPE, personal protective equipments, soaps and disinfectants are provided and used correctively. Now, this is also a commitment. Your organization will provide you the appropriate PPE as soaps, hand wash, hand rubs, disinfectants for cleaning purpose, and its use correctively. They will provide you the resources. Management will provide you the resources, but now second responsibility is yours, that how you are using these resources. So how you are using these resources, it will be written in your manual that you are using this quantity and this frequency for this particular item, like hand rub or hand wash activities, PPE, which type of PPE you are using in which department. It all will be commitment by you, and it will be written in your manual. D is adequate and appropriate facilities for hand hygiene in all patient care areas for healthcare provider. This is also a commitment. Sorry, this is also a core element, that in all the clinical areas, all the patient areas, the management, organization will provide you the proper hand washing facilities, so that it will be easy for the staff for frequent hand washing. Next is isolation and barrier nursing facilities are available. This is the achievement. Isolation means if your organization will have a separate isolation room, isolation area, or a particular isolation ward for the infected patients, like contact, droplet, or airborne disease, which we have to reduce. We have to control, and we have to break the mode of transmission of these activities. For that, your organization will provide you the particular isolation area. Nursing barrier facilities means if the patient is contaminated with any viral infection like HIV, SCV, HBsAg, or the patient is on multiple drug resistant organism contaminated with that particular organism, you have to provide the nursing barrier facilities for that. So these facilities which you are providing for isolation, which you are providing for nursing barrier, these facilities will also written in your manual that what type of activities you are doing for that particular element. And in barrier nursing, you have to provide the like PPE, hand washing, separate linen. So how you are doing, how you are separating the linen, how you are discarding the waste of that particular patient, you have to write down all these in your manual. This is one of the achievement element. Next is HIC. Third, the organization implements the infection prevention and control program in clinical areas. First element is the organization adheres to standard precautions at all time. This is the core element that your organization provide you the personal protective equipments for reducing the mode of transmission, for reducing the infection, and for this you have to prepare the policy of standard precautions. B, the organization adheres to hand hygiene guidelines. This is a core element. Hand hygiene guidelines should be clear everywhere where you are washing your hand, where your hand rub facility is available. You have to write the post over there. You have to paste a particular WHO post over there. So, and there should be a separate policy for hand hygiene guideline as per the reference of WHO, and this policy will written in your manual. The organization adheres to transmission-based practices. This is the commitment. The organization will work for reducing the transmission-based infections. So for that, you have to prepare a policy for transmission-based practices. In this, your organization will provide you the PPE, how you are using, and in which situations, which type of PPE you are using. It will be written in your manual as per the CDC reference. D is the organization adheres to safe injection and infusion practices. Safe injection and infusion practices means one needle, one injection, only one time. This line is recommended by the CDC guidelines. As per the CDC reference, you can create your own policy for the safe injection and infusion practices, and this policy will written in your manual. For this implementation, for the implementation of this element, you have to create a daily practice form that covers few points that the staff are using this policy or not. It will be given by the WHO. Appropriate antimicrobial uses policy, and it will also document it. Appropriate antimicrobial uses policy will developed as per the microorganisms developed in your organization. So it will created as per your positive ratio of the micro department reports, microbiological reports, and the culture reports. So if you find that few antibiotics are not working in your organization, you can de-escalate, and this policy and this implementation will done by the infection control officer and microbiologist and the clinicians also. F is the organization. The organization implements the antimicrobial uses policy and monitor the reduction of antimicrobial agents. In this clause, the organization will proper monitor, like if you are an infection control nurse, you will proper monitor that the patient having this antibiotic from this time to this time, like 1 day, 2 day, 3 day, 5 days, 10 days, the what is the duration, which type of antibiotic your clinicians are using. If you find that your clinicians are using like high risk antibiotics, restricted antibiotics, you can ask for the justification form for the same particular patients, and that form should be filled by the clinicians only. So this is the core element. Now in this element, you have to work for the monitoring of antibiotics, antimicrobial uses, that if your clinicians are not using your policy, you can ask them, you can ask for filling the justification form that why you are not using this policy, and you can change accordingly, you can change your policy accordingly also. So if you are changing this antimicrobial uses policy, then it will be discussed in the minutes of it will be discussed in the committee meeting, and again write down in the minutes of meeting. Last one is the organization implement the antibiotic stewardship program. Antibiotic stewardship program is a tracking program. In this, you are tracking the multiple drug resistant organisms, that if there is a multiple drug resistant organism, you have to separate it. You are tracking MRSA, you are tracking VRE. So according these tracking patterns, you are recording your actions, you are recording the percentage of the antibiotic uses, and educate your staff, educate your clinicians also for proper use of antibiotic. So these antibiotic policy practices, these antibiotic policies elements were not done by the infection control nurse, it will done by the infection control officer or microbiologist. But it should be written in the manual only. HIC 4 is the organization implement the infection prevention and control program in support services. The organization has appropriate engineering control to prevent the infections. This is the commitment. This commitment will be given by the organization, by the management, that they are providing the appropriate environment for patient care services. In this, the temperature of OT, which temperature they are providing us for the OT procedures, air quality, water quality, as per the reference of NABH guideline. So this commitment will be given by the management, these all commitments will written in the manual. B is the organization designs and implement the plan to reduce risk of infection during construction and renovation. For this, this is also a commitment. For this, if your organization planning for such construction in the patient care area, you need to fill a ICRA form. ICRA form means Infection Control Risk Assessment Tool. This will be provided. This will be you can find this tool from the WHO guideline, WHO site. Sorry. So the organization designed the particular risk assessment tool for the renovation and construction tool. So before this, before starting the construction or renovation, you have to notify that the tool will be filled by infection control department, infection control nurse, or any engineering person can participate for filling this tool also, but it should be documented in the infection control department only. The auditor will ask you that there is any construction work happened in your organization. So you can answer that yes, it worked and we filled the ICRA form for that. C is the organization adherence to housekeeping. The organization adherence to housekeeping procedures. The housekeeping procedures means that you have to prepare a checklist. You have to identify the disinfectant, which type of disinfectant your housekeeping staff is using, and what is the frequency of your housekeeping procedures in high-risk areas, low-risk areas. Give me a minute, guys. My screen is visible to you, all of you?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Sorry.
Yes, ma'am. Yes, ma'am.
Sir, what is the total work?
Hmm. So C is the organization adherence to housekeeping procedures. I already told you the housekeeping procedures will defined in the manual as per the guidelines, as per the CDC guidelines, and as per the provided resources by your organization. And the housekeeping staff will fill a proper checklist for the housekeeping procedures, and the infection nurse will check these checklists once in a day according your convenience. D is biomedical waste management will handled uh, properly and safely. This is a core element and it will be handled by each and every staff member, that you need to separate the biomedical waste according to the policy.
ये करने के पहले
Which type of
आज की
waste
और training
needed for the red, blue, yellow, and sharp. And if possible, you have to autoclave that waste in your organization, then send to the outsources facilities. So it will be documented in your manual that which type of waste you are handling and what is the quantity of your waste. It should be documented in the checklist, and it will be handovered to the infection control department once in a month. E is the organization adherence to laundry and linen management procedures. The laundry and mainly in so many organizations, if the organization is not big, the laundry department is outsourced. Somewhere this department is insourced. So this you have to create a separate policy for handling the laundry and linen management, for handling the infected and non-infected linen management. So it will be documented in your policies, and your staff should be trained enough by the infection control nurse for handling these type of linens. F is the organization adherence to kitchen sanitization and food handling issues. This is also a commitment in this, that your these this departments is outsourced mainly in so many organizations. So you have to create a policy. You have to create a policy as per the zoning of that department, that how you are handling, how you are labeling, and how you are distributing the food to the patient. It will there are so many points involved in this, that storage, the food should be stored in which temperature. It will be written in your manual. What is the frequency of food handling in your organization? What is the temperature of that department? Which type of PPE your staff are using for distributing the food, preparing the food? And the segregation part, that food storage area, cooking area, and washing area should be different. It will also cover in your manual. All type of food articles, food items are stored in proper temperature. Like if they are stored on room temperature, these articles should be stored in proper storage room. If they require refrigerator temperature, it will be stored in proper refrigerator temperature or a proper segregated storage area also. And uh, the distribution and distribution part for the distribution parts, which type of PPE, which type of gloves your staff is using, this will be seen by the infection control nurse. One point that you have to cover, that they will send the cultures, they will send the food cultures, and they have to store their food samples for at least 24 to 48 hours, so that we can test these samples properly, and if we find any non-compliant in these samples, we can recheck samples. So your organization should, the kitchen staff or kitchen management should store these samples accordingly for 24 hour or 48 hours. All the food articles like morning breakfast, lunch, and evening snacks, night dinner, all samples should be kept in proper trays in a proper refrigerator, like 2 to 8 degrees Celsius, so it will be safe. So these are the commitment for kitchen sanitization and food handling. Yes, one more thing, that the utensils which you are using for the patient serving items, they should be dried. They should be stored in dried. Their moisturizer at that place. HIC 5. That standard is the organization take actions and prevent healthcare associated infections in patients. This is the surveillance part. This is the clinical surveillance part for infection control nurse. And it will be done on the day-to-day activities. If you lose it, you cannot break the mode of transmission. So you have to know which type of infections happened in your organization. For that, you have to control your register. You have to note down each and every patient which introduce any device. If any device introduced in your organization for any patient, you have to write down, you have to monitor these patients, you have to monitor the parameters for reducing the hospital nosocomial infection. There are 4 indicators. First is the organization take actions to prevent catheter-associated urinary tract infection. This is a commitment. These all are commitment. So the infection control nurse is work for reducing the UTI infections which uh, occurs in your organization after introducing the catheter. Second is the organization take actions to prevent the infection related ventilator associated pneumonia. This is for VAP. Third is the organization take actions to prevent catheter linked blood stream infection. The organization take actions to prevent the surgical site infection. So these are 4 indicators which we covered in our clinical surveillance. And for clinical surveillance, we have to create a particular register for high risk areas and low risk areas, like for ICUs and for wards. So if your infection control nurse is working for that, it will work for reducing the nosocomial infection rate. So in this, you have to create a register. For this register, like if you are working for the catheter associated urinary tract infection, the catheter for this catheter urinary tract infection, you have to cover proper parameters. You have to write down the name of the staff, name of the patient, doctor, UHID, and diagnosis, which type of parameters are positive, like fever, TLC, DLC, when the catheter inserted by which type of antibiotics are given to that patient. So these are the parameters. It is completely a different topic. So these parameters and which type of activities you are doing, it will be written in your manual. And these activities will done by the infection control nurse for the clinical surveillance. So at the end of the month, you will calculate that days, you will calculate the positive ratio of the these indicate these nosocomial infections, and make your graph accordingly. HIC 6, the organization performs surveillance activities to capture and monitor infection prevention and control data. The scope of surveillance, this is, I already told you that then this is a surveillance activities for tracking and analyzing the infection risk, rate, and trend. This is the core element. This activity is done by the infection control team. In this, when you are tracking the clinical surveillance by the infection control nurse, so your infection control team will calculate and analyze the in infection control risk, how what is the risk in your organization, and what is the rate and what is the trend of infection control activities in infection control rate in your organization. It will be written in the manual as your scope. B is verification of data is done regularly by the infection control team. This is also a commitment. So verification will be done by the infection control officer and the microbiologist in the infection control team, because day-to-day activities will be done by the infection control nurse. But these what type of data he or she is collecting, this should be verified by the infection control team only. Surveillance is directed towards the identify the high risk activities. Now, when you are identify the high risk activities in your manual, like which type of OT procedures you are doing for the high risk procedures, which type of high risk activities are done in your organization, you have to create your surveillance panel accordingly. These all elements are commitments. You have to work for that on the daily basis. D is the surveillance include monitoring compliance with hand hygiene guideline. This is also core. Hand hygiene guideline, hand hygiene manual is already created by yourself as per the WHO, and you have to monitor, the infection control nurse will monitor that your staff is following that proper steps, following that practice or not. For this monitoring, you have to fill a WHO tool
तुम्हारा वेट तो कम होने वाला है।
WHO toolkit for the surveillance, and at the end of the month you have to calculate your percentage also. E, surveillance include mechanisms to measure the multiple drug resistant organisms. So when you are collecting the data, when you are going for the clinical surveillance, you have to you have to identify the multiple drug resistant organisms from the lab, which patients comes positive and which type of organisms comes in our organization. You have to separate them, and you have to create a separate register for identifying these patients also, that these patients are infected with MDR bugs. So we are using nursing barrier facilities for reducing the mode of transmission. Surveillance include monitoring the effectiveness of hand hygiene, housekeeping services. This is also a core element, and in this you have to monitor the effectiveness of housekeeping services. How will you monitor it? You have to collect the environmental cultures for that. First, you are doing clinical surveillance. Now you are doing environmental surveillance. In an environmental surveillance, when you are collecting the swabs, when you are collecting the air plates, it will show your effectiveness of housekeeping services. Feedback regarding surveillance data is provided regularly to the appropriate healthcare providers. In this, you have to collect the feedback from the patient's attendants, that your service is good, your service is satisfactory. For this, this is for this you have to create a feedback form for HIC reducing factors. The organization identify and take appropriate actions to control outbreak of infections. This is also a commitment. If the infection control identify any breakdown in the day-to-day activities, like any common bug present in a particular ward, a particular ICU, or particular area, you have to identify it. And after that, you have to call your committee members and take appropriate action for reducing this infection. Surveillance data is analyzed and appropriate kappa is also taken. So this is also a commitment. If you identify any outbreak, if you identify any non-compliant in your surveillance in clinical and environment also, then you have to fill the kappa form, that is corrective and preventive action form, and this form will be discussed in the committee and written in the committee meeting also. So after you have to do this activity after analyzing the data, and it will be done once in a month. Now HIC 7th is infection prevention measures include sterilization and or disinfection of instruments, equipments, and devices. HIC 7 covers in the CSSD department, that is a sterilization department for the hospital activities. First element is the organization provide appropriate space and appropriate zoning for sterilization activities. In this, your CSSD department will prepared as per the zoning protocol, as where the infected items place, where what is the area for autoclaving and what is the storage sterile area. It will be divided in a particular zoning, and this zoning will be provided by the organization to the staff for providing proper patient care facility. And this policy is written in the manual. Cleaning, packing, disinfection, storing, and issuing of the items is done as per the written guideline. This is the core. So this written guideline is you can take from the CDC, and this guideline will be written in the manual, and your department will run according to the manual written guideline. Reprocessing of single-use instruments, equipments, and devices are done as per written guideline. Now, there are few items which we are reprocessing. So, which items are reprocessing and which are single-use items? This also written in your manual, and which item you are using for how many times, this is also written in your manual, and your staff will done work accordingly. Regular validation test for the sterilization is carried out and documented. For this, in CSST department, we are using biological indicators and clinical indicators in the autoclave procedures, and these indicators will be documented in a particular register for the reference. E, the established recall procedures is implemented when outbreak is the sterilization system is identified. If any outbreak happened, then what is the recall procedure in your organization? It should be written in the manual. Now, eighth is the organization take actions to prevent or reduce healthcare associated infections in its staff. Now we are talking about the staff, how we are using our policies and procedures, how we are working for reducing the infection in our staff also. Element A is the organization implement health facilities and safety to provide the risk of transmission of microorganisms among with the healthcare providers also. For that, we are providing the vaccination program to the staff for tetanus, for HBsAg. So, and the medical also. So, it will be written in your manual, and you have to create your Excel sheet accordingly, that you are providing in providing medical health checkup, and you are providing the vaccination at the time of joining. If your staff is already vaccinated, you are doing the titer, and you are checking in on the regular interval. So it will be a commitment, and it will be written in your manual as per the CDC guideline. The organization implement the immunization policy for its staff. This is also same. In this, the immunization policy means you are giving the immunization policy for HBsAg and hepatitis B and tetanus. But for kitchen staffs, you are giving hepatitis A also and typhoid also. The organization implement work restrictions for the healthcare providers with transferable infections. This is also achievement. If you have enough staff, you can divide your staff, that particular staff is work for the nursing barrier area, work for the isolation area, and work for the non-clinical area. So this is also a achievement. The organization implement blood and body fluid measures of blood and body fluid preventions. This is also a commitment. And it will be written in your manual as the spill management as per the CDC guideline. Last is appropriate post prophylaxis, post exposure prophylaxis. It will be written in your manual that which type of prophylaxis you are providing if any needle stick injury happened in your organization. So these all about the elements, and these all about the standards of HIC. Now, if you want to ask any questions, you can ask.
So anybody have any questions? So please ask.
If you are reading CDC guideline, if you are reading WHO guidelines, you can identify, and it will easy for you working in this HIC department. Everything what we are doing, what we are using, it's all about CDC guideline.
If anybody have question, किसी को कुछ question पूछना है तो please आप पूछ लीजिए.
Hello, ma'am.
Yes.
Please, just a minute.
Can I ask one question?
Yes.
Okay. So in a crash cart, we used to keep medicine that save life-saving medicine. So last time we used to keep it cotton, like to provide safety, because sometimes by mistake we move the crash cart, and some medicine it broke. So I want to say, like, can we put cotton or we cannot put now anymore?
Your voice is not clear. Can you write down the question in the chat box?
Okay, okay.
Yeah. Meanwhile, who is Lalita? आप कुछ पूछ रहे कोटी के बारे में? Lalita.
Anybody have any question related to this topic? अगर कोई question है किसी को तो please पूछ सकते हैं.
सोनाली.
हाँ नाली पूछिए आप अपना question.
ये ललिता ने क्वेश्चन लिखा है, मुझे इंफॉर्मेशन चाहिए था, यदि पेशेंट कैथेटर के साथ हॉस्पिटल में आता है और उसका यूरिन कल्चर पॉजिटिव, तो क्या कर सकते हैं? आप हैं ललिता यहाँ पर अभी?
ललिता है. मैम आप आंसर दे दीजिए, शायद आई थिंक ज्वाइन है वो.
ओके. अगर कोई पेशेंट ऑलरेडी कैथेटर के साथ आता है और उसका कल्चर पॉजिटिव आता है, तो डेट विल बी नॉट योर हॉस्पिटल एक्वायर्ड इन्फेक्शन। वो पेशेंट ऑलरेडी कैथेटर के साथ आया है, मीन्स वो किसी और हॉस्पिटल से कैथेटर इंट्रोड्यूस करा कर आया है। तो वो नोजोक्रोमियल इन्फेक्शन है, बट आपकी ऑर्गेनाइजेशन से हुआ नहीं है, तो आप उसे अपने कॉटी में काउंट नहीं करेंगे।
ओके, अनदर क्वेश्चन मैम किसी ने पूछा है, हाउ टू कैलकुलेट द वैप?
Calculation of VAP is the total number of ventilator positive VAP, total number of positive cases upon total number of catheter days multiply by 1000.
And another question from Rahul Yadav, HIC2.
Can we keep cotton?
And another question is, can we keep cotton in crash cart along with medicine for safety purpose, or we cannot? Lanu might have raised this question.
I think there should be a separate cabin for that.
And recap about HIC2, Rahul Yadav.
Recap means?
No, ma'am. Recap about HIC2.
ये रिपीट करने के लिए तो नहीं कह रहे हैं।
Yes, ma'am.
HIC2 is the organization provide appropriate and adequate resources। मीन्स आपकी ऑर्गेनाइजेशन को रिसोर्सेज प्रोवाइड करने हैं आपको आपको तो उसके लिए वो एक सेपरेट बजट क्रिएट करेंगे, जो कि 2% होगा एनुअल इनकम का। तो उसमें वो एक पूरा एक्सेल शीट क्रिएट करते हैं कि वो आपको कितने रिसोर्सेज प्रोवाइड करेंगे। रिसोर्सेज मीन्स आपको कितना मैन पावर देंगे, कितना आपको वो पीपी पर्सनल प्रोटेक्टिव इक्विपमेंट्स देंगे, हैंड हाइजीन फैसिलिटी देंगे। तो दिस इज ऑल अबाउट द HIC2 कि उसमें आपको रिसोर्सेज के बारे में बताया गया है कि वो कितना रिसोर्सेज देंगे और आपको उस रिसोर्स को कैसे इन्वेंट्री करना है, कैसे यूज करना है। ICU कल्चर एंड OT स्वैब कल्चर फ्रीक्वेंसी।
ICU culture and OT swab culture frequency.
It
Please tell
should
me.
be
ये
once
question.
in a week because
One
these all about the high risk areas.
Okay. Now Krishna Kant Pandey put a question, ma'am. What is ICSI? From Krishna, what is ICSI?
मैडम एक मेडिकल और एक्टोपिक प्रेगनेंसी से रिलेटेड एक क्वेश्चन है।
हाँ जी,
प्लीज
तो
बताइए।
उसी के बारे में मैडम हमें जानना था कि आईसीएसआई होता क्या है मैम, उसमें क्या हम लोग करते हैं?
ये ICSI HIC का नहीं है।
ओके,
यस
ये
मैम।
आपका अलग टॉपिक है। आप नेक्स्ट टाइम हम रखेंगे तो उसमें आप पूछ सकते हैं ये। ठीक है।
ठीक है
ओके
मैम,
मैम,
ठीक है मैम।
एक ललिता
मैडम
ने
मैडम हेलो मैडम, एक्सक्यूज मी, जिसमें हम लोग कोई भी कल्चर स्वैब कल्चर करते हैं, जैसे हम लोग यूरिन के स्वैब कल्चर करते हैं, तो हम क्या इंडिकेशन में हम देखते हैं?
यूरिन का स्वैब
कोई भी। यस मैम।
यूरिन का स्वैब कल्चर कैसे करते हैं?
सॉरी मैम, यूरिन ब्लड का स्वैब कल्चर मैडम।
ब्लड का भी स्वैब कल्चर आप कैसे करेंगे? आप दो क्वेश्चन एक साथ पूछ रहे हैं। स्वैब कल्चर आप एनवायरमेंट का लेंगे ना?
यस मैम।
आपका क्वेश्चन अभी सही नहीं है।
ठीक है मैडम।
ठीक है, मैं नेक्स्ट
उसको मैम,
क्वेश्चन।
ठीक है। ओके।
ओके, सो फ्रॉम ललिता, हम अपने हॉस्पिटल में कॉटी के इंडिकेशंस।
अपने कॉटी के इंडिकेशंस ये जो इंडिकेटर्स हैं, इनके इंडिकेटर्स होते हैं पेशेंट के पैरामीटर्स को जब आप डेली बेसिस पे चेक करते हैं। आप उसके लिए प्रॉपर जो रजिस्टर क्रिएट कर रहे हैं पेशेंट इंफॉर्मेशन राइट डाउन करने के लिए, तो उसमें आप प्रॉपर लिख रहे हैं कि पेशेंट कब एडमिट हुआ, किस डायग्नोसिस के साथ हुआ, सेकंड डायग्नोसिस उसका क्या है, और उसके पैरामीटर्स क्या पॉजिटिव हैं। पैरामीटर्स लाइक फीवर, फ्रीक्वेंसी, अर्जेंसी, TLC, पॉजिटिव रेशियो ऑफ कल्चर। तो जब आप ये सब इंफॉर्मेशन लेते हैं आफ्टर इंट्रोड्यूसिंग द डिवाइस, तो उससे आप कॉटी को डिफाइन कर सकते हैं कि ये पेशेंट ये इन्फेक्शन लेकर आया था या फिर हमने डिवाइस इंट्रोड्यूस करने के बाद उसको दिया है।
Okay, and the next question from Diksha Parab. What is actually meant when there is no backflow in central line, but still medicine can be given via?
दिस इज अ डिफरेंट टॉपिक अगेन।
Okay, okay. Ma'am, what is benchmark? Sumanpreet is asking, what is
Benchmark will
benchmark?
be defined as per your organization, as per your practice. Because अगर आप 1 ईयर में आपने जितना वर्क किया है, 1 ईयर में जो आपका ट्रेंड रहा इन्फेक्शन का, लाइक अगर आपके यहाँ 10% रहा है UTI, तो आपको अपना बेंचमार्क खुद से क्रिएट करना है कि नेक्स्ट ईयर में आप उस बेंचमार्क को किस लेवल पे ला सकते हैं, लाइक 2% पे, 1% पे या 0% पे। उसके लिए आपको आपको क्या वर्क करना है, कितनी प्रैक्टिसेस डेवलप करनी है, वो आपको एक बेंचमार्क क्रिएट करना है और आपको वो अचीव करना है। वो आपको प्रॉपर अपनी मैनुअल में शो भी करना पड़ेगा कि आपने ये अचीवमेंट किया और आपने ये बेंचमार्क क्रिएट किया। वैसे तो बेंचमार्क सीडीसी के अकॉर्डिंग भी होता है, गाइडलाइंस के अकॉर्डिंग, बट वो गाइडलाइन तो कहती हैं कि आप जीरो कर दो, बट आई थिंक इट्स नॉट पॉसिबल कि आप एकदम से 10% से जीरो पे जाएंगे। आप उसको धीरे धीरे करके रिड्यूस करेंगे, तो वो आपकी ऑर्गेनाइजेशन के अकॉर्डिंग ही डिफाइन होगा।
गुड इवनिंग मैम।
गुड इवनिंग।
मैम सुमनप्रीत मैम, दिस इज माय क्वेश्चन जो भी आपने आंसर किया।
हम्म।
मैम मेरा यही पॉइंट था कि जैसे हम लोग अपना पीपीटी में बेंचमार्क दिखाते हैं, तो अभी तक तो मतलब जो प्रीवियस मेरा रहा है तो उसमें तो मैम जैसे 4.5 या 4.6 समथिंग ऐसे परसेंट दिखाते हैं। मैम एक्चुअली बेसिकली मतलब इसमें बेंचमार्क का मीनिंग ये है कि हम टारगेट फिक्स करते
यस।
हैं अपनी पूरे ओवरऑल ईयर का परसेंटेज
यस।
देख के। ओके,
तो आप
थैंक
अगर
यू सो
कह रहे
मच
हैं कि
मैम।
वो 4 समथिंग आपकी ऑर्गेनाइजेशन में रहा है, तो आप उसे 1% या 0% पर इजीली ला सकते हैं।
ओके मैम, ओके, थैंक यू सो मच मैम।
Okay, another question is how to calculate surgical site infection rate.
Total number of surgical site infection upon total number of surgeries multiply by 100.
And now next question, Jemima Rosie has put frequency of fumigation for ICU and labor room. Can you share, ma'am?
This will be created by yourself again, क्योंकि आपकी और आपके आईसीयूज में कितने इन्फेक्टेड पेशेंट्स हैं, लाइक आपने फ्रीक्वेंसी उसको वीकली बना ली। यूजुअली होती वीकली है कि हम एवरी संडे करते हैं और उसके बाद हम कल्चर सेंड करते हैं, बट विद इन दिस वीक अगर अब कोई इन्फेक्टेड पेशेंट्स आ जाता है, लाइक ट्यूबरक्लोसिस का पेशेंट आ जाता है या फिर एमडीआर का पेशेंट आ जाता है, तो हो सकता है कि आपको फ्यूमिगेशन या डीप क्लीनिंग बीच में भी करनी पड़े। तो आपको उसके अकॉर्डिंग अपनी डिसइंफेक्टेंट की पॉलिसीज क्रिएट करनी पड़ेगी, लाइक आप कब उसको फ्यूमिगेट कर रहे हैं और कितनी बार आप उसको डिसइंफेक्ट कर रहे हैं, डीप क्लीनिंग कितनी बार कर रहे हैं। तो वो सब आपके ही ऊपर डिपेंड है, आपके पेशेंट्स रेशियो के ऊपर डिपेंड है।
Okay, so next question is, ma'am, what about OT air culture?
OT air culture will be sended once in a week, air and swabs both.
So now one question from Konika Bharadwaj. While taking air sample in OT, should HEPA filter keep on or off? And what is reason behind that?
एक्चुअली ये बिल्कुल सेपरेट टॉपिक है, इसके लिए बहुत थोड़ा ज्यादा करना पड़ेगा। तो अभी मैं डीपली तो नहीं बता पाऊंगी, बट यस हम उसको स्टॉप करते हैं बिकॉज जो जो फिल्टर है वो एएचयू के थ्रू होता हुआ आता है, तो वहां पर वो एयर सर्कुलेट होती रहती है, तो हम उसे स्टॉप करके, बिकॉज हम वो जो प्लेट है वहां पे 30 मिनट्स के लिए रख रहे हैं। तो जब हम उसे 30 मिनट्स के लिए रख रहे हैं तो 30 मिनट पे एक ही एयर प्रेशर रहना चाहिए, एक ही टाइप की एयर फ्रिक्वेंसी रहनी चाहिए और एक ही क्वालिटी रहनी चाहिए। इसके लिए उसको ऑफ किया जाता है।
And Shikha put a question, ma'am, how to collect the quality indicators?
This will be collected by day-to-day activities from clinical surveillance data. Like जब आप ये क्लिनिकल सर्वेलेंस कर रहे हैं, कॉटी, वैप, एसएसआई और ब्लड स्ट्रीम इन्फेक्शन का डेटा, क्लिनिकल पेशेंट्स का डेटा, डिवाइसेस का डेटा कलेक्ट कर रहे हैं, तो जब आप उसे मंथली बेसिस पे कंबाइन करेंगे तो वो कंपाइल करने पर इंडिकेटर में ही कन्वर्ट हो जाते हैं।
And Malasri question is that please MLB culture, ma'am.
MLB
MLB culture, medical law buyer.
ये भी मेरा टॉपिक नहीं है,
No, okay.
टॉपिक नहीं है।
So, ma'am, what is OT quality parameters?
OT quality parameter is defined as per the CDC, as per the WHO for with engineering department. तो वहां पर मेनली आपको हेपा फिल्टर की क्वालिटी चेक करनी है, एयर का प्रेशर चेक करना है, एयर का टेम्परेचर चेक करना है, डीप क्लीनिंग चेक करनी है, और एवरी सर्जरी के बीच में कितनी ड्यूरेशन आप दे रहे हैं, किस तरह से इंस्ट्रूमेंट क्लीन कर रहे हैं, कौन सा डिसइंफेक्टेंट यूज कर रहे हैं, वो सब आपको अपनी मैनुअल में ही नोट डाउन करना। तो ये ओटी क्वालिटी में ही आता है, और ओटी ओटी से कनेक्टेड होता है सीएसएसडी डिपार्टमेंट। सो यू हैव टू इंश्योर दैट योर इंस्ट्रूमेंट्स आर ऑल्सो प्रॉपरली स्ट्राइक्ड।
So, Mosmi is a question how to calculate HAI in ward. And Malasari told HAI in ward means, ma'am. I think both questions are same.
हाँ, HAI in ward. दिस इज ऑल अबाउट द डिवाइस. अगर वार्ड में किसी पेशेंट को कोई डिवाइस नहीं इंट्रोड्यूस करी है हमने, लाइक कैथेटर नहीं दिया है, सेंट्रल लाइन नहीं दिया है, या वेंटिलेटर तो ऑब्वियसली वार्ड में नहीं दिया जाएगा, बट अगर कोई भी डिवाइस हमारी तरफ से इंट्रोड्यूस नहीं करी गई है तो हम उस पेशेंट को नोजोकोमियल इन्फेक्शन में नहीं काउंट करते हैं, बिकॉज हमारी काउंटिंग ही आफ्टर 48 आवर्स शुरू होती है. तो वार्ड में आपको सिर्फ दो चीजें पे फोकस करना है. अगर पेशेंट को कोई डिवाइस इंट्रोड्यूस है तो तब आप उसे फोकस करेंगे, और अगर उसको कोई मल्टीपल रिस्ट्रिक्टेड एंटीबायोटिक या हायर एंटीबायोटिक प्रोवाइड करी गई है तब आप उसे मॉनिटर करेंगे.
Another question is HEPA filter कब change होते हैं OT में?
6 month.
Okay, so Daisy, I have a question, ma'am. Can we do fumigation? Actually, it's outdated, right? Can you explain about this, ma'am? We have to do or not?
It is outdated as per the guideline. It is outdated, but few organization is still doing this. But in my organization we are doing deep cleaning. We are doing deep cleaning on regular basis. We are not fumigating. But if any high risk activity is done in the organization with the infected patient, अगर कोई भी मल्टीपल ड्रग रेसिस्टेंट बग है या फिर ट्यूबरक्लोसिस बग है या कोई हायर वायरस प्रेजेंट है, तो आपको वो एरिया फ्यूमिगेट करके ही क्लीन करना पड़ता है. तो उस केस में आपको करना है, अदरवाइज इट इज आउटडेटेड. इफ योर ऑर्गेनाइजेशन प्रोवाइड यू द इनफ डिसइंफेक्टेंट फॉर डीप क्लीनिंग, you can go for the deep cleaning also.
And somebody asked, what is the air quality ratio in the ward?
Same.
Same. Lalita put a question, ma'am. Normal OT temperature and humidity and pressure कितना होना चाहिए?
It depends on the surgery.
So as of now, I think everyone gets the answer. And just a minute, ma'am, one more question. When will we consider patient is having SSI? Major points to diagnose SSI.
SSI, UTI, वैप, कॉटी, ये अपने आप में पूरे बड़े टॉपिक हैं. ये जो लास्ट टॉपिक पूछा गया है ये पूरा डिफरेंट टॉपिक है, तो आई थिंक उसके लिए फिर बाद वो कर लेंगे. बट इसमें शॉर्ट में मैं ये कह सकती हूँ कि SSI को आपको कैप्चर करने के लिए प्रोसीजर रूम में जब पेशेंट आता है तो उसको कैप्चर करना है. प्रोसीजर स्टाफ है फोकस करेगा, वो स्वेलिंग पस प्रेजेंट इज देयर और नॉट, और वहां से उसको उसका सैंपल भेजा जाता है लैब में. अगर वो कल्चर पॉजिटिव आता है देन वी कैन डिस्कस दिस केस विद द क्लिनिशियन दैट इट कम्स इन फॉर SSI और नॉट. तो वो उसके लिए आपको पेशेंट के घर जाने के बाद भी फोकस करना होता है, ट्रैक करना होता है ऑन कॉल्स एंड फ्रॉम द प्रोसीजर रूम ऑल्सो व्हेन द पेशेंट कम फॉर द ड्रेसिंग. आपका म्यूट है.
Okay, one more last question, मैम. डीजे स्टेंट रिमूव होने के बाद इन्फेक्शन होता है, उसे SSI में ले सकते हैं क्या?
ले सकते हैं.
सो आई थिंक एवरीवन गेट देयर आंसर. सो विल ट्राई कि आपका जो नेक्स्ट वेबिनार हो, हम जो टॉपिक्स अभी आपके रह गए जो लेंदी हैं वो हम उसमें आप लेकर आए जिससे कि आप उसका सेशन ले पाए. ओके, सो नाउ आवर एकेडमिक हेड विल जॉइन दिस.
Very good evening to everybody. Thank you so much, Megha. I think every time we have noticed that आपके webinar में maximum number of questions come, and this is such an interactive session, and we are so proud to have you on board with us. Thank you so much. एवरी टाइम हमें होता है बच्चों का डाउट है तो मेघा का सेशन रखवा लें, बिकॉज आई थिंक यू एक्सप्लेन सो वेल. आप इतने अच्छे से एक्सप्लेन करते हैं, एंड पॉइंट टू पॉइंट आई थिंक एवरीबडी हैज so many doubts, and those doubts are cleared so well and with so much of patience. So thank you so much, Megha, for that. Thank you so much. We at Astron we are very grateful to you that you are a part of our academic team. And you are thank you so much for every time for being so good and so patient with our children, and thank you so much, Megha. Thank you.
Thank you. My pleasure, ma'am.
Thank you. And it was a wonderful webinar. A very big congrats to the online team, to Ms. Dhanmi, to all her counselors. A good number of students came to us. The topic was very well put up. The PPT was well presented. I think number of doubts that we had, they were all very well addressed. And also हमें नए topics मिले कि अब हम next webinar किसके ऊपर रख सकते हैं. So thank you so much everybody for taking out time for us. And thank you so much, Megha, and wishing you all a very happy weekend. Thank you.